Tonight, the WHO ups the global risk level for new coronavirus, while Tapia Hospital urges adequate port health security. The fire service notes a rise in house fires and says many of these disasters can be avoided. And the Labour Department intervenes and investigates complaints by former Highline Poultry employees. We have the details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Friday, the 28th of February, 2020. Welcome to the Hot 7 TV Nightly News. We're on Flow Channel 117. The broadcast is also being simulcast on Kiss FM Radio, on our mobile app, and our Caribbean Hot 7 TV Facebook page. I'm lovely Saint Amy Joseph. Thank you for joining us. Tapia Hospital is urging the Ministry of Health to be on the cutting edge of preparation as it relates to new coronavirus. A call has been made to ensure and enforce adequate port health security in St. Lucia so as to minimize the possibility of entry of foreigners who have been infected. The private hospital is also urging collaboration with countries like Martinique and Cuba, who have the experience of fighting infectious diseases. The World Health Organization, WHO, has upgraded the global risk of the coronavirus outbreak to very high, its top level of risk assessment. The WHO said the risk level was intended to serve as a reality check for governments, since healthcare systems are still unprepared. More than 50 countries have now reported cases of new coronavirus. Here in St. Lucia, private hospital Tapia has urged the general public to be vigilant, but to remain calm. However, Tapia says the bedrock for the public being able to remain calm is having confidence in the system. Internist at Tapia Hospital, Dr. Benjamin, underscores the need for the Ministry of Health to take the lead at the ports where the threat of new coronavirus is concerned.
Port health security is, in this situation, very, very big. We need to tighten up on our port health, our airports, our seaports. Generally, our port health is so important to screen adequately those foreigners who are coming into the country, even before they get here. And those who arrive here, screening them adequately so that we could isolate them even before they mix with our general population. So port health security is a very significant part in that fight. And the Ministry of Health is leading that port health security aspect, and we need to be guided by them.
While Dr. Benjamin commends the Ministry of Health's preparedness protocols, the former Vice President of the St. Lucia Medical and Dental Association, Dr. Paul Castellendo, previously took the ministry to task regarding its process of quarantine at the Victoria Hospital for a Russian national earlier this month. Dr. Benjamin says when it comes to quarantine and isolation, the Ministry of Health has to make do with the resources at hand.
Our thing is this, that any patient with or who tests positive for COVID-19 should be isolated away from the general hospital population and quarantined in an isolated place. But that is within reason, simply because for resources. St. Lucia is not a wealthy nation, so we don't have all the resources necessary to build a new hospital in a few days like China and build a new isolation plant. So we have to deal with what we have. And I think the ministry is doing a fantastic job with the resources that we have at this point and the protocols that has been laid out.
Tapia Hospital is putting its own protocols in place to prepare for new coronavirus or COVID-19, guided by the Ministry of Health.
We do have protocols which are in conjunction with that of the Ministry of Health. Tapia Hospital is currently, we're currently constructing an isolation bay where if these patients come to us, we could keep isolated and be guided by the ministry's point of isolation thereafter. Also, we advise patients that if you have flu-like symptoms, fever, cough, shortness of breath, or other respiratory symptoms, that you call first before you come, instead of just coming to the hospital and mixing with the other patient population. So you call ahead, call your general practitioner, call the hospital and tell us what symptoms you are having so we can direct you further In the event all that is slipped up and somebody gets here, we are building currently an isolation bay where we can house those patients temporarily until we adhere to the Ministry of Health's protocol. Like I said, the Ministry of Health has to be the lead.
At least 210 people in Iran have died as a result of new coronavirus disease. Globally, more than 80,000 people have been infected. About 2,800 have died. The first British death from COVID-19 has been announced. It was a passenger on the Diamond Princess cruise ship docked in Japan, Iceland, Nigeria, Mexico, New Zealand, Belarus, and the Netherlands all reported their first cases of new coronavirus. Switzerland suspended all events with more than 1,000 participants until the 15th of March. As new coronavirus continues to remain an epidemic around the world, the Department of Health and Wellness is working assiduously to ensure that the public is sensitized on ways to prevent the spread of the infection. More in this report from Fennel Neptune.
Although St. Lucia has no confirmed cases of the coronavirus, the Department of Health and Wellness is calling on the public to take the necessary precautionary measures to prevent the spread of an infection. Health educator of the Bureau of Health Education, Nadej Smith-Lambert, spoke on the standard recommendations an individual should practice to minimize the spread of an infection.
So the Ministry of Health and Wellness would like to remind persons out there to remember as often as possible to wash your hands with running water and soap. In the event you do not have running water and soap, you could use hand sanitizer with an alcohol base of 60% and up. We would also like to remind persons that if you use tissue to sneeze or to cough, you should throw away the tissue into a bin. If you do not have tissue and you really need to sneeze or cough, you do it in your inner elbow. We would also like to remind persons that you could practice cleaning down your surfaces with a little disinfectant, just to ensure that any viruses that are on the surfaces are gotten rid of.
Smith-Lambert also provided guidance on when and how should a person use a mask to control infection transmission.
So a medical mask is not required for members of the general public who do not have any respiratory symptoms. You wear a mask if you are coughing or sneezing, or if you are taking care of somebody who has respiratory symptoms such as coughing or sneezing. Masks are also only effective when used in the right way. So you would also have to incorporate hand washing. So you wash your hands with running water and soap.
The Department of Health and Wellness encourages businesses and workplaces to ensure hand sanitizers are readily available and accessible to customers and employees. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennel Neptune.
Officials at the Ministry of Health and Social Development in the British Virgin Islands have announced that there are no confirmed cases of new coronavirus or COVID-19 after online reports sparked fears that a returning national could have the disease. The ministry issued a statement on the 28th of February stating that it was notified of a returning national whose travel history and flu-like symptoms led to the isolation and testing of the individual in accordance with normal response protocols. Presently, the individual is confined at home and the COVID-19 test has been done to confirm whether it is the novel coronavirus infection. The results will be available within 3 days while the ministry's surveillance team conducts contact tracing and monitoring of people who had close contact with the individual. The BVI authorities advise citizens to avoid outbreak areas or contact with visibly sick people. The public was also advised to frequently clean hands by washing with soap and water for approximately 20 seconds or using a 70% to 95% alcohol-based hand sanitizer. In other news, the St. Lucia Fire Service is asking citizens to take every precaution necessary in order to avoid damages and loss due to fire. The St. Lucia Fire Service notes that there has been a rise in the number of house fires and believes that most of these fires are avoidable. The warning comes on the heels of 2 house fires, one that left a family homeless.
A stark warning is being sent out to citizens by the St. Lucia Fire Service in the wake of a rise in house fires, which has left families homeless all over St. Lucia. Jermaine William, who is the acting divisional officer attached to the fire service headquarters, said the SLFS has been inundated with house fires of late and they are looking into ways to reduce the numbers.
The St. Lucia Fire Service has seen a rise in structural fires, predominantly wooden structures over the last couple of months. Although the Christmas season was pretty quiet in terms of structural fires, but from the beginning of the year we've seen a rise in structural fires. We have not been able to pinpoint the exact cause of those fires. However, we have noticed, and the fire investigators are called to the scene of those fires, and with the hopes of finding the cause so that we could advise persons.
Williams said persons need to do their part in preventing those fires.
There are certain precautions that can be taken to mitigate those kind of structural fires. For example, we ask persons not to overload circuits. Do not plug too many appliances to one outlet. Okay. Do not leave your standing fan on if you live in the house. Do not leave your cylinder, your small LPG cylinders connected when you leave the house for work. There are certain measures that can be put in place that we as just ordinary citizens can take. So we advise persons to just be cognizant of the fact that fires start in a host of different ways, and as much as possible we have to take the necessary precautions.
Between Saturday the 22nd and Thursday the 27th of February, the SLFS reported 3 house fires, including one which occurred at the very start of the Independence Day celebrations. Another occurred in Vieux Fort, leaving a family of 6 homeless. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
Thank you, Rochelle. Meanwhile, fire victim Electra James is appealing for assistance in the wake of the fire at Sarot that destroyed her home and left her family of 4 homeless.
Hi, good day. My name is Electra James. I'm from Sarot, and I lost my house yesterday about minutes to 1. Somebody called and told me that my house is on fire. On arrival, everything was gone. I saved nothing. I live with my partner, my 2 boys, and we lost nothing. We did not have time to save anything. So if anybody wants to help us in any means, you can contact me at 719-3180.
That was fire victim Electra James. This is the Hot 7 TV Nightly News. Still to come, the Labor Department intervenes and investigates complaints by former Highline Poultry employees. Are you fasting and praying for 40 days and 40 nights? And Wasco is in the hot seat after severe water disruptions. That and more after the break.